As healthcare is one of the matters which has been primarily devolved since devolution took place in July 1999, it seems particularly perverse, uh, as we're discovering from the evidence being presented to the COVID inquiry, that Johnson only chaired a limited number of meetings in which the First Minister of Scotland and Wales were present. It just seems extraordinary between Drakeford and Nicola Sturgeon. This wasn't the way that Boris believed devolution is supposed to work. Well, if health is devolved and if the COVID crisis is about health, then that's exactly the way that devolution is supposed to work. We're told that he says it's optically wrong in the first place for the UK Prime Minister to hold regular meetings with the other DA First Ministers, as though the UK were a kind of mini EU of four nations and we were meeting in a council in a federal structure. That is not, in my view, how devolution is meant to work. Well, I'm sorry, but I mean, it's an arrogant assumption that these people should be pushed out. It doesn't really matter what the political differences are between the First Ministers of Scotland and Wales and the Prime Minister. But when it comes to an issue which is devolved, then these people need to meet to discuss how best to approach it. As it was, we had three different approaches anyway, and these should have been more thoroughly and more centrally coordinated. And it would have been good, I think, during the COVID pandemic for Boris's decisions to have been challenged by somebody who was, in effect, an equal, rather than to be nodded through by other ministers and people who were distracted perhaps by things going on in their office. Oh, Gina! I shouldn't have lightened the tone, should I?